Hello everyone, welcome back to my page. Today we'll be talking about diastasis recti. It is also known as rectus diastasis or diversification of the rectus abdominus muscle. It is a common condition during pregnancy or postpartum. What it means is that someone that has delivered before or someone that is pregnant, this condition can occur. And what happens is the person's abdominal muscle is overstretched. There's a rectus. If you look at the diagram above, these muscles are the muscles that keep the abdomen, literally the stomach, in place, keeps it in shape. When this muscle is overstretched due to pregnancy or following delivery, the muscle gets weak and protrudes, and the person's belly button protrudes. And that's why you see someone that has given birth before, you'll be asking the person, are you pregnant again? And the person will be like, I just gave birth. Sometimes it doesn't go back, but with exercises it can go back. So stay tuned. Today we'll be talking about diastasis recti. My name is Dr. Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health. So if this is what you are interested in, please stay tuned and watch other videos. Subscribe to my YouTube page at Dr. Adazion, at Talks with Dr-Adazion. I'm on TikTok, Instagram, and Facebook with the name Talks with Dr-Adazion. Please follow my pages and share this video. Share them right now. Like and drop your comments or questions. I will attend to them. So diastasis recti is actually separation of these muscles. The rectus abdominus muscle is the muscle that runs vertically in front of your stomach from up to the down. There are two, that is one on each side, and at the middle they are separated by a band, a tissue called linea alba. So during pregnancy, what happens is that as your pregnancy increases in size and protrudes, this tissue, the abdominals are stretched, and this band is stretched that to an extent that the muscles stick out. To deliver your baby, the linea alba can heal and come back together. They are elastic like rubber band, but when it loses that elasticity from being overstretched with pregnancy, the abdominals will not come back the way they should be again, and there will be spaces, so the muscles will now stick out from those places, and this is diastasis recti. Remember, it's the rectus abdominus muscle, the one on the stomach, that will now stick out from those places. And the person that has diastasis recti will have the abdomen, the stomach protruding below or just above the belly button. And months or years after you have given birth, people will still think that you are pregnant. So the person will now protrude and look as if he's pregnant. That's diastasis recti. When diastasis recti occur, it's because your abdomen has been overstretched. It happens mostly at the third trimester. That is from 7 months of pregnancy. That is from 28 weeks. When the abdomen is overstretched, that can lead to diastasis. It can occur following big baby, someone that has twin gestation before, anything that just causes. In fact, so far you were pregnant before, diastasis recti can happen in you, because when that abdomen has been overstretched and those tissue cannot withhold that stretching again, they loses the elasticity. Just imagine drawing a rubber band so much that it loses the elasticity. It grows in size, and that is exactly what happens on that muscle, and they protrude outside, and the person comes like the person is pregnant. So that's diastasis. You shouldn't be ashamed of it. You did the job you're supposed to do. You gave birth to a baby, so nobody should body shame you about that. So let's go on. What are the symptoms the person will present with? Before then, diastasis abdominus occur mostly in women that have been pregnant before, but it can occur in children. It can occur in men. Anything that causes increased abdominal pressure. For someone that has tumor in the abdomen, for someone that has had that has been initially big or had some fat around that place, those muscles can lose their elasticity, and the person will not come with that protrusion. So it can happen to men, it can happen to children, but it's mostly in pregnant women, those that have had pregnancy before. And what are the symptoms of diastasis recti? If you have watched to this point and you have not subscribed, please hit the notification button, subscribe to my page, like right now, comment and share it for others to get. Most people with diastasis recti does not come with any symptom. The only thing you just see is a bulge. Your abdomen is bulging, is protruding. You hear women complain that after some years that have given birth, after some years that had cesarean section, my abdomen is still big. Especially if the person is not quite big or not on the big side, or the body mass index is of the average weight, and you see someone's abdomen protruding, it actually could be diastasis recti. So how will you know that you have this condition? When you see that bulge, you see you are sitting and that there's a bulge below or just above your belly button, it shows that you have diastasis. That bulge, when you lie down and you touch your umbilicus, that is the belly button, it feels flattened, it feels like a hollow. It's possible that you have diastasis abdominus. If you have given birth before and your abdomen is protruding and has refused to go back, it's possible that you have diastasis. So these are the ways to know that you have diastasis. Most time it's not painful. It's not painful. So what do you do to prevent you or help heal your diastasis and make it not to grow further or grow worse? The things to do is to mind the way you get up from the bed. You know, most times if you come to the clinic and you are pregnant, we advise you that when you lie down and you want to get up, turn by your side and get up from your side. We don't want you stretching that muscle as much as possible. The pregnancy is already overstretching it. Then when you have given birth, you notice that you have diastasis, don't go lifting heavy objects. Don't go carrying heavy things. Any exercise that you will do that will be protruding your abdomen, like abdominal crunch, all those things that you try to do and get up and your abdomen is protruding, they will make it worse. Then we also advise that as you are getting up from bed, as you're getting up, turn by your side and get up. You can see a physical fitness therapist to help plan your way to heal your rectus abdominis. It can heal on its own with time and with moderate exercise that does not protrude your abdomen. All you need is exercises that involve your deep abdominals. That's what you need, not the ones that protrude your abdominals. So any exercise that does not bring out your abdomen, you are doing it and your abdomen is not protruding, is okay for it. It can help heal it. But anyone that causes the abdomen to pop out, it is not okay for that abdominus. Rarely surgery is done. Where surgery is done, when there is already herniations, like an umbilical hernia following that, surgery can be done for those ones. But moderate exercise, trying to space your pregnancy, can help your rectus abdominis heal. Thank you for watching to this point. If you have any question, drop it on the comment box. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr-Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health. See you next time for another enriching video. Thank you.